This presentation is devoted to our experience with tibiofemoral angle corrections by hemiphyrodesis. We use this method more than 10 years. But we have 20 years experience with epiphysiodesis. That is the best solution for severe long bone deformities during growth. Hemiepiphysiodesis is so-called method of guided growth. We started to use 2 years ago. Epiphysiodesis has some advantages. It is minimally invasive surgical procedure. Physis or growth plate is the best place for angular corrections of growth. Epiphysiodesis can be total and or partial. We call it hemiepiphysiodesis. And epiphysiodesis can be permanent and or temporary. Total epiphysiodesis is indicated in children with one leg longer than the other in cases of congenital or acquired length discrepancy. It is performed on the unaffected extremity in scheduled time with the aim to correct length discrepancy. The boring method is used at the end of growth period. Partial epiphysiodesis or hemiepiphysiodesis, as I mentioned, the aim is to stop abnormal growth on one side of physis, correct angulations in the level of physis. We use it in cases of valgosity, varosity, and also in some cases with flexion contracture, even in cerebral palsy patients. First surgical technique of open epiphysiodesis was described by Femister in 1933. The method was done through to rotation of bone blocks at both sides of the growth plate together with curettage that caused fusion of the physis. The next used method till present is Blount and Clark method. They used epiphyseal stapling for the first time in 1949. There are in this method are some pitfalls and complications. Epiphyseal stapling has limitation because of staples. When rigid staples are affected by the powerful forces generated by growth of physis, the staples can migrate, break, or extrude. This complication can lead to inadequate correction or overcorrection. Hemiepiphysiodesis by method of 8-plate is called guided growth method. In the region of epiphysis, the 8 plates holds one side of growth plate, while the opposite side of the physis continue to expand and grow. During growth, screw diverge. Diverging screws might have function like a hinge to avoid physis compression. There are different sizes of 8 plates and different sizes of screws. Indications, as I mentioned, are angular deformities around joints in a growing child, deformities, mostly knee joint, but also ankle, elbow, and wrist joints. In cases, this method is suitable and mainly indicated in cases where it's not possible to predict residual growth of long bones. It is the best method for skeletal dysplasias, genetic syndromes, congenital limb defects, and other acquired dysostosis. The system is suitable in children from 18 months until physics are opened. Time of application usually from several months up to 1 year, usually 6 to 12 months. When the deformity is corrected, the edge plate is removed under general anesthesia, and the bone goes on in growth. We are experienced with hemiepiphysiodesis by modified McNichol-Malcolm method. It means we use drilling, permanent epiphysiodesis that is carried out by boring with cannulated tube saw of a part of growth plate. Usage of X-ray intensifier for identification of physics is necessary. We use permanent hemiepiphysiodesis in medial or lateral side, or also in ventral side for correction in sagittal plane. We treated cohort of 34 patients. 39 epiphysiodesis were carried out. Age of patients was 10 to 16 years. Indications, axial deformities. The etiology of deformities was idiopathic, metabolic, neuromuscular, genetic, traumatic, bone infections, and developmental diseases. For boring method of hemiepiphysiodesis, there is necessary to predict exactly bone age. We use for bone age method according Groyrich-Pyle and Tanner-Whitehouse 3. There is assessed 10 bones of